Well, you might not know it, but January is a month dedicated to another cancer that affects women, cervical cancer. And joining me this afternoon is Dr. Crystal Kelly. She's an OBGYN with the Lone Star Circle of Care. Thank you so much for being here today.
Thank you for having me.
So cervical cancer, a very preventable disease if it's caught early, is that right?
True. Very preventable.
And what's the best way to detect it?
So it's really important for young women to just kind of get with their physicians, make sure they're in tune with their bodies. The best way is just to follow up with your physician regularly. Annual pap testing or pap smears that women can get can easily detect abnormal cells or early cervical cancers.
Now, how is Texas doing? I understand that many women are not getting the test done that they need to.
Well, we can definitely do better, and I think that that's nationwide. But you know, the new recommendations put out by the American Congress of Obstetrics and Gynecology suggest that women start getting their pap testing starting at age 21. So from 21 to 29, every 3 years. From 30 on to 65, every 3 years. But they're actually recommending that you do the test every 5 years combined with the HPV testing, because there's certain types of the HPV virus which have been linked to or have the greatest linkage to development of cervical cancer. And
in addition to the regular screenings, are there some other tests that the women can get?
You know, I'm sorry, not the annual, that was the old recommendations. The screening every 3 years for the young women, that should be sufficient.
And again, you mentioned the HPV vaccine. There's a science behind that push, is that right? There
is. So in 2006, they licensed the Gardasil vaccine. It's a quadrivalent, which means you're getting vaccinated against 4 types of the HPV virus. It's 6, 11, 16, and 18. And of 6 and 11, they're responsible for like 90% of anal and genital warts, which can eventually lead to cancer as well. But the 16 and 18 are the high-risk types, and they found them to be responsible for up to 50% of precancerous lesions and up to 70% of diagnosis of cervical cancer. So the push is to get young women vaccinated, obviously before being exposed to the HPV virus, which is sexually transmitted.
Right.
Recommendation is for girls aged 11 to 12 years, but they can get it as young as 9 and as late as 26 years of age to kind of catch up on the vaccine.
And assuming early detection, the treatment level, the preventable level is very high.
Very high, absolutely. I mean, since the 1950s, since they've had this big push for education and prevention with the pap testing and just educating women on what they can do to help themselves, since the 1950s, they've shown a drop in 70% incidence of cervical cancer and up to 75% decrease in the mortality or death rates from cervical cancer.
Interesting. Dr. Crystal Kelly, thank you so much for being with us.
Thank you.
All right.